Namaskar, 20 July 2020. Summary of the Assam Tribune. Number 1. Who grants permission for mining? State governments. যাক mining concession বুলি কোৱা হয় for all the minerals located within the state under Mines and Minerals Development and Regulation Act 1957 and Mineral Concession Rules 1960. However, central government approval is necessary for granting the mineral concession for minerals specified in the first schedule to the Mines and Minerals Development and Regulation Act 1957. Number 2, minerals in first schedule, Mines and Minerals Act 1957. So the minerals specified in the first schedule are hydrocarbons and atomic minerals, metallic and non-metallic minerals such as iron ore, bauxite, copper ore, zinc, lead, precious stones and gold. Number 3, Environment Impact Assessment, EIA. EIA is a process which scrutinizes the potential effects of a proposed industrial or infrastructural project on the environment. It prevents industrial and infrastructural projects from being approved without proper oversight. EIA is statutorily backed by the Environment Protection Act 1986, which contains various provisions on EIA. Number 4, Accredited Social Health Activist, ASHA. ASHA is a trained female community health activist. The role of an ASHA is that of a community level care provider and selected from the community itself and accountable to it. ASHA is trained to work as an interface between the community and the public health system. Number 5, G20, Group of 20. It is an international forum which includes 19 of the world's largest economies and the European Union. G20 is a forum for economic, financial and political cooperation. It addresses the major global challenges and seeks to generate public policies that resolve them. Number 6, Indian Council of Agricultural Research, ICAR, is an autonomous organization under the Department of Agricultural Research and Education, Ministry of Agriculture and Farmers Welfare. The council is the apex body for coordinating, guiding and managing research and education in agriculture, including horticulture, fisheries and animal sciences in India. Number 7, clinical trial phases. Phase 1, testing for safety. During this phase, researchers start with small doses of the drug and measure how the body responds to determine the ideal dosing. Phase 2, testing for safety and effectiveness. This phase continues to test for safety while measuring the effectiveness of the treatment for symptoms as well. Phase 3, testing for safety and effectiveness with many patients. The largest clinical trial phase, the studies enroll hundreds of participants to test for effectiveness along with safety and side effects. Number 8, Indian Forest Act 1927. It sought to consolidate and reserve the areas having forest cover of significant wildlife and to regulate movement and transit of forest produce and duty leviable on timber and other forest produce. It also defines the procedure to be followed for declaring an area to be reserve forest, protected forest or village forest. And also it defines what is a forest offence, what are the acts prohibited inside a reserve forest, etc. Number 9, Wildlife Protection Act 1972. Wildlife Protection Act passed in 1972 has 6 schedules and each schedule guarantees varied degrees of protection to animals and plants. This act prohibits the killing, capture, poisoning and trapping of wild animals. This act also forbids injuring or removing body parts of the animals. Taxidermy is prohibited under this act, and this act also has provisions under which encroachments in protected areas may be dealt with through eviction. Number 10, vaccine. Vaccine is a biological preparation that improves immunity to a particular disease. A vaccine typically contains an agent that resembles a disease-causing microorganism. There are 4 main types of vaccines: live attenuated vaccines, inactivated vaccines, subunit, recombinant, polysaccharide and conjugated vaccines, and toxoid vaccines. Thank you. Subscribe to our YouTube channel and follow us on Facebook for regular updates.